Hi everyone, welcome back to part 2 of my series on arthritic pain. So arthritic pain, it can creep into life slowly. At first it might be a little bit of stiffness there or there, and a joint that might feel tight on cold days. But over time, these small inconveniences can start to chip away at the things that you enjoy, making activities of daily living more tiring, making movement less confident, and the idea of getting older feel heavier than it really should. But here's the truth I want you to hear. Arthritis pain is common, but it's not something you have to simply accept as your new normal. So arthritis is an umbrella term for over 100 conditions that cause joint inflammation and damage, with osteoarthritis and rheumatoid arthritis being the two most common ones. And both of these can lead to similar symptoms such as pain and stiffness and swelling, but the causes and progression of them both differ. So osteoarthritis is often linked to changes in joint mechanics over time, whereas rheumatoid arthritis is an autoimmune condition where the body's immune system attacks its own joint tissues. Now, regardless of the type though, the pain doesn't really appear out of nowhere. It's actually usually the result of gradual changes in how the joint is moving. And also, in addition to that, how well the surrounding muscles and how well the nerve system is also processing the pain signals. Now, as a chiropractor, my role isn't to just chase the pain away, but to look at the bigger picture. And pain is actually often the last thing to appear and the first thing to go away. So focusing only where it hurts can mean that you're missing the deeper cause. Now, chiropractic care then helps by restoring healthy movements to the joints that are stiff and restricted. It also reduces stress on the surrounding tissues. It helps with balancing and the muscle support, because when your joints move better, the muscles that support them can activate more effectively. But also, more importantly, it's enhancing your nervous system's communication, because a well-functioning nervous system helps your body coordinate healing and repair much more efficiently and effectively. Chiropractic care also reduces compensation by correcting movement patterns, which prevents overload on the other joints and muscles. Now, the thing is, sometimes people miss that managing arthritis pain, it doesn't happen just here in the practice, but it's also about building habits that keep your joints healthy day after day. That includes staying active, like walking. You also be wanting to be maintaining an anti-inflammatory diet, keeping hydrated to keep your cartilage and your joint tissues well nourished. You also want to allow time for recovery between your activities. You want to support your posture and alignment in your daily routines. So this really breaks the myth that nothing can be done. So it's really one of the most harmful beliefs about arthritis is that nothing can change its course. Now, while we can't change and reverse a joint damage that's already occurred, we can definitely slow the progression, reduce pain, and help you regain confidence in your movement. I've seen many people across all ages return to activities they never thought they would get back into doing, and it's simply by addressing the underlying mechanics of their pain. So, arthritic pain, it doesn't have to be a daily reality, and by combining chiropractic care with supportive lifestyle strategies, we can help to ease your pain, protect your joints, and keep you doing the things you love for longer. So if arthritic pain is affecting your movement or your quality of life, I'd love to help you explore your options. To book an appointment, you can call us at Provolution Health on 6299 2660, and together we can work to create a plan that works for you.